All right, welcome back, everyone. Well, August is Psoriasis Awareness Month, and we want you to get more information. This is an opportunity for us to educate and inform everyone on treatments, causes, triggers, and the true management of psoriasis. So to tell us more about this is longtime friend to CW39 herself. She's back, Dr. Brooke Goldner. She has been here for 4 years, since 2019.
Yes.
The last time, of course, the first time you were with us. She's an autoimmune disease specialist, for those of you who don't know, and knows a lot about psoriasis. So tell us, what actually is psoriasis?
So psoriasis is actually one of the most common autoimmune diseases. 125 million people have it around the world, about 8 million in the US, and it's one that attacks the skin. And it's different than other autoimmune diseases in that it's pretty equal between the sexes. Men and women get it pretty equally, and it's where the immune system starts attacking the skin, and the skin starts trying to grow to replace itself, and it grows into these thick plaque-like lesions. And it's very uncomfortable. It can be itchy or painful. It can be embarrassing. Sometimes someone will think it's contagious when it's not.
Right.
And in 30% of the cases, it can turn into arthritis as well, which can be very debilitating.
Wow. And for a person who was young who gets psoriasis, I mean, to be debilitating at such a young age can be just horrific for them, right?
Yeah, Kim Kardashian shares about it. So she has psoriasis. She's posted pictures of herself with it, and she developed arthritis at one point where they were afraid maybe it was lupus, but it turned out to be psoriatic arthritis.
And because of her, I know the discussion has really increased, especially with younger people too, removing the stigma behind it, right?
Absolutely.
So what can you do to actually help to improve it, and not only the skin itself, but your body internally?
Well, you know that's what I love to talk about.
I know you do. I do.
There's so much you can do. So it turns out with psoriasis that one of the biggest risk factors is obesity. And at first they thought maybe obesity causes it, but it turns out it's the food.
Oh,
They
gotcha.
did an experiment at University of California recently where they fed mice either regular mouse food or basically the mouse version of cheeseburger, fries, and a milkshake.
Wow.
And after
Oh my
4
God.
weeks, the mice developed psoriasis-type lesions. And so what they found is if you eat a diet high in saturated fat, meat, dairy, highly processed foods, refined sugars, much higher risk of developing psoriasis. And those same types of foods cause the leading cause of death for psoriasis and everyone else, heart attacks.
Yes.
So heart attacks, diabetes, all those things. So, you know, in my book, Goodbye Autoimmune Disease, the foreword is actually by a woman who had psoriasis, and she was not obese, she was an athlete, but within 2 weeks of eating really nourishing plant foods, the lesions went away. So she actually now goes on stages and puts my face way too big on the screen, saying she saved my life. I'm like, man, can we just bring it down a little bit? But it's really important that there's so much you can do. If you can control your stress, go on vacation sometimes,
Yes.
relax, do that kind of self-care, sleep, and feed your body the right fuel. You would never put the wrong fuel in your car and expect it to take you to work every day. You got to put the right fuel in your body if you expect it to take you where you want to go as well.
And I love how you always talk about fuel, and we just showed, of course, the beautiful video of you just making one of your smoothies and all that. You can find all that information in your books as well.
Absolutely.
So, okay.
Yep. At goodbyelupus.com. I give away free information. I'm live every week doing free Q&As for the public. I'm always trying to educate people so they can get healthy. I'm lupus-free 18 years now.
Oh my gosh.
And I just want other people to get to live their lives and be healthy too.
And your website one more time.
Goodbyelupus.com.
All right, check it out. We're going to have more with her, of course, on our website as well, Dr. Goldner. So good to see you.
It's great to see you too.
You got to keep on coming back.
I will.
All right. All right. Don't